Hello, everybody. It does take a few minutes for people to kind of move from the other room into this kind of main session here. If you are in the DC area, it is beautiful out here. Of course, you're listening to the recording, then it may not be beautiful anymore, but we are excited to have you here today for our last webinar of the year. And I'm going to put this in present mode. So we are going to more formally welcome Dr. Namazi here in a couple of minutes, but welcome, good morning, Dr. Namazi. We're so glad that you're here. And my name is Debbie Rosen, and both myself and Lindsay Toms, who is behind the scenes here today, are the owners of the StudyPro. And actually, Dr. Namazi and I were talking, while she's the principal owner, we both have two female owners, so we're just another thing we were very excited about. And so the way that we're going to go this morning is I'm going to talk a little bit about the StudyPro for just a minute and our summer programs, and then I'm going to introduce and talk, and we're going to hear, of course, from Dr. Namazi. And I also wanted to mention that A, this is being recorded, and B, we are going to maybe take some relevant questions throughout, but then we'll also have time at the end for questions. I know this is a topic that people tend to have a lot of questions on. I wanted to share just a minute about the StudyPro because we know that most students don't struggle because they're lazy or unmotivated. I know Dr. Namazi very much agrees with that. We have never met a student that doesn't want to be successful, but it's really those invisible barriers that are often rooted in executive function. And those are the types of things that you're seeing here on the screen, like getting started, staying focused, really knowing how to plan. So what we do at the StudyPro is help students notice what's really getting in their way. And the notice word is a really big word for us because we notice things. Once we notice things, we can then look for a strategy, look for a solution, understand the barrier, look for a solution. And that's really kind of a central theme and motto for us, StudyPro. So it's not just about getting organized or just about planning or just about finishing homework, because that is kind of the result. But the key is about life skills and about helping students to really build the confidence that they can overcome things that are hard. Because when students really understand why they're stuck is when they can really finally move forward and figure out, and that's really where the confidence begins, and that's our goal. So we do this in the context of coaching, one-to-one coaching. I'm sitting here in our homework center. We do it to help students practice those skills that they may not have developed yet. We also have study skills course, writing coaching, math coaching, which we're doing all summer. So I just wanted to mention that summer is, of course, a great time to build these skills because we know that kids walking into the school year in the fall with more confidence is a great way to start. And so we do a specific type of executive function coaching over the summer called academic resilience coaching to help really build a lot of those skills and muscles and having that chance to reflect, as well as math and writing coaching, building strategies and bridges from one year to the next. And then we have kind of our flagship study skills course, as well as a writing course, both very focused on the process. So time management, organization, breaking work down, how to study for tests. That's our study skills course. And then the process of writing, which really does trip up kids that have some executive function challenges. The calendar there is just to show you that we do offer these every single week. So you just pick one week that is free for you that we want to use to kind of help get kids back in school mode or help kind of fill in some of the gaps they have as they're moving to another level of academic rigor. And very exciting, I don't even know if we shared this with you, Dr. Namazi, but we are launching our very first AI, how to use AI to improve executive function. And it is going to be incredibly interactive. Kids are having via an API using AI to be able to understand how to break down assignments, how to understand things they might not have, simplified concepts. It's not about having AI do the work for you, of course. It's about helping them to be better critical thinker, better support with prompts, and how to, again, notice what are the barriers so they can ask ChatGPT for that type of support. So we're super excited. It's a 3-hour workshop. and it's offered every single week this summer. So again, you just pick one, and that has been officially launched. And with that, and we hope to see everybody here this summer, really wanted to give a more formal welcome to Dr. Namazi. And as I mentioned, she's the principal owner of the Stixrud Group. And I'm going to introduce you, Dr. Namazi, as I stop my share so you can start your share. We know that the Stixrud Group, founded by Bill Stixrud, has been kind of a leader in neuropsych testing and testing for all levels, for all ages, since I really came on the scene with my 25-year-old son. And I myself have had my son tested by Stixrud. They have the highest standard of care in terms of the neuropsychs that work there. And Dr. Namazi and I actually first met with a shared student that was working both with Stixrud and with us. And so we're very excited to have you here, Dr. Namazi. Thank you for everything that you contribute to the community and for again being here today. And I'll go ahead and turn things over to you. I really appreciate it. We're excited to demystify neuropsych testing.
Great. I'm so excited to do this. Thank you so much for the opportunity. So I'm going to share my screen. And hopefully you can see it, and I'm just making sure that it's presented in the right way. Debbie.
Yes, I will let you know if there's a problem.
Okay. Okay. So thank you all so much for having me. Like Debbie was explaining, I am the principal owner of the Stixrud Group, and we are a practice. We specialize in neuropsychological assessment, and I'm really hoping today to equip you all with tools on how to understand neuropsychological evaluations and just big tips on what parents really need to know. So, what to expect here? I will start with a cursory review of the brain. And not to worry, this isn't going to be anything too complex or sophisticated, but I think it's important to talk a little bit about the brain because that will set the foundation of how the rest of the talk will go and why it's important. And then I will briefly review the different types of evaluations, the most common types of evaluations that are available, and the differences between them. And also, a common question I am often asked by friends, by clients, by all sorts of people is how to know if your child actually needs testing. So hopefully I can answer some of those questions as well. Finding the right provider to do the testing, if you do opt to pursue testing, is extremely important. And I want to spend some time talking about that. And then I will provide an overview about the process and how to make sense of the results and what to do with the results.
So Dr. Namazi, I did want to mention that I think we can see the presenter mode. So I don't know if you wanted to use the slideshow that's in the upper left that says like use slideshow.
Okay.
Oh,
Did it stop sharing?
sorry to miss you. Yeah, it did stop sharing, but
Okay. So let me see if I can do that. Thank you for telling me.
yeah, no problem.
Okay. How about that?
Yes, that's
Okay.
perfect.
Okay. Okay. Oh, I need to know how to click this. Here we go. Okay. So why talk about the brain? And Debbie, I just want to let you know I cannot see the clock now, so you'll have to give
Okay,
an update on
no
how
problem.
you're doing the time. Okay.
Yeah.
So, why do I think it's important to talk about the brain? So, the brain is so important in so many ways. The prefrontal cortex, which I'm sure a lot of you have heard about, is the part of the brain it's in the frontal part of the brain, and it's responsible for executive functioning, which is a broad umbrella term for higher order abilities like planning, organization, time management, and so forth. The prefrontal cortex actually begins to develop in utero. So it begins before birth and it continues through adulthood. So we think it actually continues up until the third decade of life. It is the last part of the brain to develop, which is, always interesting and talking to parents about that because we know that conditions like ADHD and autism and other learning differences, we might see some delays in prefrontal cortex maturation, which can then make executive executive functioning more difficult, which is why we have executive functioning coaches like the StudyPro and so forth who can help with that. So this is important in setting the stage, I think, to understand the different types of evaluations that are available. So the first type of evaluation that is commonly available is a school-based evaluation. This evaluation you can get through the school system, and the major goal of this evaluation is to understand educational impacts and how the child's learning, but how it's affecting them at school primarily. It's not clinically diagnostic, so it wouldn't necessarily tell you about clinical syndromes or clinical differences like ADHD or a language disorder or so forth. It really, the purpose of school-based testing is to understand how their learning is affected in school and what they can do about it at school. A psychoeducational evaluation provides more information, and what that provides usually is assessment of intellectual functioning as well as achievement abilities, which refers to reading, writing, and math. Now, it is a little bit limited in that sense because it usually, again, I say that with a caveat because, of course, all of these evaluations will differ. But with psychoeducational evaluations, you usually only get IQ and reading, writing, and math scores, and that might be enough depending on what the student is dealing with, and it can be the most cost-effective method. So of course, because it saves time and so forth. So of course, it's not a useless type of evaluation. It can be helpful depending on the type of kiddo and the issues that we're seeing. A psychological evaluation is typically diagnostic. That process usually involves a clinical or counseling psychologist, so a doctoral level provider. And we typically, in a psychological evaluation, you may assess a range of conditions like autism or ADHD and so forth. A neuropsychological evaluation, on the other hand, is the most comprehensive. So, neuropsychological evaluations really focus on understanding brain behavior relationships. It really emphasizes looking at the child and looking at the individual as a whole and what brain functions are impacted, as well as how the kiddo is learning. It's the most comprehensive type of evaluation. It's really considered the gold standard, in my opinion. You get the most bang for your buck, I think. So, what is a neuropsychological evaluation? Again, I'm asked this a lot, and this it's a good question. So, a neuropsychological evaluation, it's a comprehensive type of evaluation, and it gives a lot of detail. It should give a lot of detail about your child's brain, particularly their strengths and also their areas for growth. Now, I'm often asked, like, okay, so you tell me that my child has this. Like, what does that mean? Is that all I get from you? Absolutely not. In fact, diagnosing is this big. So much you get so much more out of a neuropsychological evaluation. It's not just for diagnostic purposes. A label is just a label at the end of the day, but understanding what to do with that information, how to help the child move forward, and how to help the family understand the child. It's so much more than that. And for us at Stixrud and just myself as a provider, we really focus on strengths based evaluations. And we really try to give as much, if not more, attention to strengths because there's so much that kiddos are really good at. And we try to understand those facets in addition to understanding what's going on and why they're struggling. But the strengths part is really useful. And in fact, I think it can be quite life changing. And an evaluation, a neuropsychological evaluation, can also help provide input on guide on potential career directions. So, an example I often give is if your child wanted to be an architect, wouldn't you want to know if they were good with spatial relations, which we'll talk about what that means, as well as math? Like, wouldn't you want to know that they were actually good at those things? Personally, I'm not good at those things. I would not have made a good architect. My husband is very good at those things. So I think it's helpful to have that type of understanding and confirmation in providing guidance for careers. A neuropsychological evaluation gets down to the point of what's actually going on. So what this means is that there could be a myriad of reasons why a child is struggling with like reading or math, and it's not you want to understand what the actual reason, the etiology is that's giving rise to the problem. So for an example, a good example I think is that reading encompasses a lot of different skills. We have sounding out of words, which is decoding. We have reading sight words. We have reading quickly, reading fluency. And we also have reading comprehension, which actually is mediated by receptive language. So if your child's complaining like I have trouble reading and such, don't you want to know what actual skill they're struggling with? Because that can also help infer intervention. So a child who may struggle with decoding may benefit from a certain type of approach versus a child who struggles with understanding what they're reading could benefit from another type of approach. So I see it as a really good investment. And again, it can give us this really amazing roadmap about how your child ticks, what they're really good at, as well as what are some areas that they could use some help with. I also just want to make sure everyone understands that not all evaluations are created equal. People have their own style and do things in their own ways. So just keep that in mind. If a provider says they do a neuropsychological evaluation, and we're going to get to this actually later in the talk, but I want to kind of throw that out there so you understand that it's not enough to just say we do neuropsychological evaluations. There's so much more that goes into it. A good neuropsychological evaluation should also be able to shed light on school placement. This is important too. And it can be really helpful actually for that. So and it can infer therapies and so forth. So again, which we'll get to later in the talk. So just to
Dr. Namazi,
yeah,
can I just ask real quick,
sure.
when you say can shed light on school placement, do
Mhm.
you mean like which school, or do you mean like what classes within a school, or both?
All of it.
Okay.
So and I will talk about that more, but I mean we can review it now. So a neuropsychological evaluation should be able to tell you, does the student need a smaller class size? Do they need a high input, low output environment, which I'll talk about what that means? Does the student need a placement where they need movement breaks or they need check-ins from teachers? I mean, there's so many things. But if private school, for example, is on the table, make sure that the neuropsychologist knows the schools. I mean, we're often visiting schools, we're talking to schools, because the neuropsychologist should be able to help you figure out like what type of school environment and literally what school it might be a good fit for the student.
Okay, thank you.
Sure. So, Debbie, you already kind of reviewed this, but I just wanted to mention who we are. So, we only do neuropsychological evaluations or social cognition evaluations and consultations. We were founded in 1985. Dr. Bill Stixrud started our practice in 1985, and he started with the premise that there is a place for every child in this world, and that's how we roll. That's our mentality, and that's how we are with every child we see and every client we see. We try to provide really detailed roadmaps and guides for parents, for teachers, for therapists, and so forth. It's important that we write our reports in language that is applicable to a varied audience. So a teacher should be able to pick it up, a therapist should be able to pick it up, a parent should be able to pick it up, and they should be able to read and understand exactly the child and what's going on. And Dr. Stixrud actually paved the way for us in understanding that evaluation is so much more than just giving a label. It's really an amazing opportunity to understand your child and for the child to understand themselves. Okay, this is a question I get all the time. How do I know if my child needs an evaluation? This is a hot topic. Something that Bill taught me years and years ago was whenever a parent has a question regarding their skills in any area, like in, their attention span, they're not great planners, or they have trouble with language, or they can't seem to understand what I'm saying to them, or reading is getting really hard for them, or, socially they're starting to struggle, and emotionally they seem really down. These are all good reasons to pursue more information. So whenever there's a question about your child's development, that is a good enough reason for me to suggest testing. I do think for parents, we don't always trust ourselves. I mean, I'm a mom, and I can speak to that myself. We don't always trust ourselves, and almost every time I test a kiddo, parents will say to me, "I wish I did this sooner. I knew I should have done this sooner." And it's never too late either. I mean, no matter the age, it can be beneficial. But I really encourage parents, you got to trust your instincts here. You really do.
And one quick question, Dr. Namazi,
Sure.
was what is a social cognition evaluation, unless you're going to talk about it later?
Oh, no, we can talk about it now. So, a social cognition evaluation at the Stixrud Group. So, this is just the Stixrud Group. I wouldn't be able to speak to other practices, but that's a type of evaluation that looks at social and emotional functioning. So, usually the child would have had a comprehensive evaluation beforehand, or maybe not. But usually it is the case that they've had some kind of testing beforehand, but there's a lingering question of a social difference like autism or we're still not clear, does my child have OCD, or is this like bipolar disorder or something like that. So it doesn't look at cognitive functioning or academic functioning. So we wouldn't do tests that involved intellectual ability or planning or organizing and that kind of stuff. We'd look primarily at social cognition. So it would be understanding if the child's ability to pick up on social cues, read social situations, and so forth, in addition to understanding their mood and if there's anything underlying lying that.
Thank you.
Sure. It's a good question. Okay, so other reasons to consider testing might be if the child has had some sort of medical event, like a concussion or a seizure or something, and you're noticing a change in their behavior. That could be a good reason to consider testing to understand where their skills are. Teachers expressing concern is also another reason to consider testing. Oftentimes, my parents will say, "Oh, this teacher said this over the years, or this teacher said that." That's a good enough reason to see if there's anything else going on there. Oftentimes, we're getting referrals from pediatricians. So pediatricians may notice differences in the child as well, and they're referring for testing. And I just see a typo, and I apologize for that. Child themselves, this is a big reason. This is actually what I hear the most, believe it or not, is that the child themselves are asking for help. They're noticing that something's different. They're noticing they're learning differently. They're noticing that they need more help with this or that, and they want to know why. And that to me is a really compelling reason to pursue an evaluation. Okay, so I thought it would be helpful to review a case example of a student I tested several years ago to give you an understanding of the practicality of testing and what a neuropsychological evaluation can tell you and what to expect out of a neuropsychological evaluation. So this particular kiddo, he was a 14-year-old rising freshman. He is the sweetest, gentlest boy. He had always been really good at math and gravitated towards math courses, very spatially inclined, which means that he had a good understanding of space and manipulating objects, and he loved to build with Legos, for example, when he was little. He loved puzzles and that kind of stuff. He was always really good at those things. He had never had an evaluation before. So this was his first time getting tested, and he was just like the smartest, most eager to please kid. He was just like a gem. His history included that he did not ever like to read, and this dated to the early years. And he always had trouble with spelling, and that was something his parents have noticed. Um, at the time that I tested him, and we'll call him Johnny. At the time I tested Johnny, teachers did not have concerns about him. They thought he was wonderful. Again, he seemed attentive, he seemed attuned, he seemed to get it. He seemed fine. But the parents, listening to their guts, which is what I always say to do, always suspected like something just wasn't clicking with him. He wasn't getting it with reading. There were other things he was struggling with, and it made them worried. Johnny, even though teachers didn't have concerns, his grades were uneven, which means that he wasn't performing at the level that you would expect given his brightness. And when 8th grade hit, he really tanked. And that's what prompted parents to pursue something else. And the classes that he tanked the most in were reading and writing heavy classes. And as a result, Johnny, being the most eager, sweetest kid in the world, felt really bad about himself, and he started to get really sad and feel like life wasn't worth it anymore and just had like low self-worth, which is very sad to see. So as a result of, the parents were so amazing and they were so on top of this that they found an educational advocate. I think another friend had suggested that they consult with somebody, and they found this amazing advocate who suggested a comprehensive neuropsychological evaluation. They didn't know what it was until, understandably, that until the advocate suggested this. And I met with the family, a few months before the testing appointments, just to get a sense of what was going on with him and to give them some initial guidance on what to do while they were waiting for the testing appointments. And at that time, I had suggested that Johnny do some reading tutoring because it looked like he was struggling with reading, and just do some tutoring for now, and that'll give me an opportunity to collaborate with the tutor as well to see what's going on, and let's see how it goes. And in addition to that, I had also recommended, which you don't see here, but I'd also recommended some psychological help because he was feeling so low. So I got him in with a therapist as well. And, I saw Johnny for testing, and the results were pretty in line with what I expected to see. He is a gifted kid, and he was gifted verbally, and he also had quite strong nonverbal IQ skills, which we'll talk about what that means later in the talk. It also showed that Johnny, while he could get himself going and focus for short periods, he really struggled focusing for longer modalities, but he was a really good masker. He kind of just would like sit there and look, and it made you, it would look like he was focusing because you can't necessarily see inattention, which is something I explain to parents a lot. You may not see it. That's why we have testing. The results also revealed mild dyslexia. So the evaluation turned out to be really helpful for this family. And what it did was that, even though the teachers were not seeing problems, it did help get him an individualized education program, which was special education services. He was considered or is considered a twice exceptional student, and those students can be harder to detect. So he gets a range of supports during school. He also, given the challenges that we detected, I was also able to help them find some specific interventions for reading and so forth, which helped him. And in turn, his self confidence improved and he just felt so much better about himself. I spent a lot of time with Johnny talking to him about what this all means for him and explaining to him that there are a lot of strengths that actually come from dyslexia that are research proven, whatever that means, and explaining how that is the case for him and what that means for him. And I think that he found that really, really helpful, and it validated him because he knew, I mean, kids often know like something isn't working or something's not clicking, but until he had testing, he thought he was stupid. And he's so smart, and he was able to walk away
Mhm.
understanding that he is very bright and he learns differently.
I think that's a really important point. I just want to mention that I think we sometimes are worried about sharing a quote unquote diagnosis with our child, but at the end of the day, they really do know. And I'll just very briefly, Namazi, share the punchline of the story I told you earlier about, when my son found out he had was diagnosed with ASD, which is autism spectrum disorder, he was actually so relieved. He was running around like, as I said, wearing his cape,
Mhm.
and telling everyone he knew. So it is sometimes very much a relief. I know it doesn't always land that way, but I think at the end of the day, if we present it in the right way and look at it in those ways, as like how can we, with the strengths-based view, it can be a very powerful thing to know.
Debbie, I can't agree more. I think kids need to know, and kids often do know on some level. And as a mother myself of two children, it's always harder for parents than it is for the kid. And as is everything in life, it's the delivery of the message. And that's
Mhm.
why, and this is a good segue that, it's so important to find the right provider for your family because I often tell kids, about their diagnoses and what this means. And I always try to start with all the strengths and explaining the type of brain. And I believe that these labels like autism, dyslexia, ADHD, these are just fancy words for brain types. And that's how I explain that to my kiddos, and what it means for them. And when you're finding the provider for you, if you do pursue this, ensure obviously that they have experience in what you're searching for. So if you're worried about your child's learning or their reading, make sure the neuropsychologist has a learning disability background and that they understand learning disorders. If you're looking, if your child has learning differences and you're wanting a different school placement, make sure that the neuropsychologist knows the schools. Make sure that they know how to navigate the school system. Writing a report, which I touched on a little earlier, but I don't feel like I can emphasize this enough. It is so important that the evaluator knows how to write a good report that is applicable for a varied audience. That means when, I'm testing a student, I send them to you all for executive functioning at StudyPro. I want you, Lindsay, or whoever's working with this kid to be able to read that report and know what's going on and know what's helping, what might help this kid. In turn, I want my teachers to be able to pick up a report, and read it, even though they can be quite long. And honestly, teachers often don't have time to read the whole report, but I want them to be able to get good information from that report too, and to know what it actually means. I don't like reports that have a lot of jargon in them. I want to read a report that tells the story about the child. And that's how I write reports. I write stories. I also think it's important that the provider is collaborative and thorough. And what that means is that the provider takes the initiative to seek outside information about the child. This means calling coaches, calling teachers, calling tutors, calling therapists, collaborating with all of the adults, especially, I mean, of course, as long as the parents are okay with this, but collaborating with as many adults as we can who know the child well so we can have a comprehensive understanding of the student. I find that really critical, and that's how we work at Stixrud. Finally, the most important thing probably out of all this, well, one of the most important things, is that the personality style of the clinician is one that would click with your child. We all have our own personalities. I'm a little bit more bubbly, and I work with some people who are a little more reserved, and your child has their own personality, and the types of people they click with and who they don't click with. So just making sure that the personality style of the evaluator, gels with your child, that's really important too, because you want your child to feel comfortable when they're getting tested. This to me, is the most important thing. So I don't think our field does this enough, and it bothers me. But in my opinion, the most important part about all this is that the child understand themselves. And I see this as being done in multiple ways. So I think that the provider should always meet with the child at a separate appointment. I prefer to do this at a separate appointment because sometimes parents, understandably, these meetings are 2 hours long. They're hearing a lot of numbers, they're hearing a lot of stuff, and it can be quite overwhelming. And I like to give parents a little time to make sense of what we discussed. I view, and at Stixford, we view that final appointment, which I will get to what that means, as a critical part of the evaluation because we're still talking through things. It's a team oriented approach. We're still collaborating about what this means. And I'm still trying to understand parents and how they're hearing what I think and so forth. And it can be an overwhelming meeting. So I like to set up a different meeting with the student to discuss the results. And the way I talk to kids is not the same. Obviously, it's the way I talk to parents. So when I'm talking to kids, I go really far into using strength-based language. I try to use the information as empowering and motivating to them, by also validating them, which is a really careful, and I think a really strategic balance, and it can be difficult to achieve at times. But again, a lot of these kiddos, they know something's different about them. And they want to know what it is. So I want them to know what it is. So I try to explain the areas for growth, in a way that's validating at the same time by highlighting all the things they're really good at. And usually there's a ton of things that kids are really good at. I also believe that kiddos need their own written document following the testing because as you're listening to my talk right now, you're taking this in, but are you gonna remember everything I said? No, of course not. So, Debbie is you're recording this, you'll have this available, you have slides to refer to. It's the same thing with these feedbacks. That's why we give reports to parents too, because it allows them to refer to that document for years to come. And I believe that children deserve the same kind of respect. So they should be able to refer to a document for years to come. So the way that I achieve this is I write every kid I see a letter. And the letter, again, is written in language that's on their level, and it explains the results again in ways that make sense to them, and it gives them that opportunity to be able to look at it in the future. Okay. Another piece of advice that I don't think a lot of parents know about is that it is perfectly okay and maybe even advisable to request a consultation meeting with a provider before you sign up for an evaluation. It's totally okay to do this. And in fact, you may want to do this. Testing is an investment of your time, of your money. It's vulnerable for parents, it's vulnerable for the child, and you need to feel comfortable with the provider. And by requesting a consultation, it would allow you some time to meet the provider, sit down with them, ask them whatever questions come to mind, don't hold back, and just make sure that their methods and their personality and all that stuff is in line with you and what your goals are. Okay. So I wanted to put a slide in about this because I'm often asked about this as well. And what does testing actually look like? So the actual testing process is usually done over a day or two. And that would involve the child or the client coming in. They should coming physically to the office. They should. It's usually again you want to ask whoever is testing your child about this, but we usually advise students to take their medications as prescribed prior to the sessions. They should eat and drink as normal. We want them to get a good night's rest. If they don't sleep well the night before, we want to know about it because poor sleep can actually look like ADHD when really it's just poor sleep. So we want to know about it. And the child will undergo different types of instruments that require talking, that require writing, playing, clicking on a computer. They're not hooked up to any machines. We are asked that. So I just wanted to make sure that parents understood the actual process. And here is a visual to give you a sense of what it might look like. Again, this is the Stixrud Group. This is how we do things. This is not universal. But I do think that there's some commonality here. So typically the parent would call the office, they would make an appointment for an intake, they would talk to an intake coordinator free of charge for 30 to 45 minutes. At that time, the intake coordinator gets a lot of information about what's going on and so forth. And then they would schedule the appointments and the parents would meet with the clinician for an interview. And it's usually a 1 to 2 hour interview where the clinician's really trying to understand what's happening and getting a lot of information. And then the child comes for testing, and the parent doesn't have to be in the room. So I'm also asked that. The parent doesn't have to be in the room. They can stay in the waiting room or they can drop and come back, depending on the age of the child, of course. And then after the actual testing is completed, the clinician will take the results of the evaluation and interpret them, make sense of them. And in that process, they also should be, again, I'm saying this with a caveat that it's a should be, calling providers to collaborate and calling coaches like Debbie or calling, the tutors and saying, this is what it's looking like. Like, what do you think? Are you noticing this stuff? What do you think about this? And then after that, parents should be meeting with the clinician to discuss the results. And that session, again, it's usually 2 hours, and that's where when the clinician is giving information about the results. But also for us, it's a really critical part of the process because we're still learning. We're still trying to understand things from the parents' angle, and that is also why we don't provide the report before that appointment because that appointment is still a part of the evaluation process. We view that actually as disrespectful, to be honest. We like that appointment to learn more about the kiddo from the parent. And then the clinician should meet with the child to review the results, and then the parents receive the report.
So Dr. Namazi, there was a question about the initial meeting being in person with the clinician? I mean, I'm assuming that if people are not local or will make it remote
Yeah.
could be an option, but
Yeah, so at the Stixrud Group, we do a lot of those meetings through Zoom now, and we find that it's quite convenient for parents too. So those appointments can be if the parent wants to do it in person, we're happy to, but we find that most parents prefer to meet with the clinician over Zoom. The testing is almost always in person. I say that with the caveat that we do testing all over the country, so we'll do social cognition testing in different states. But again, it's a case by case basis. But the neuropsychological evaluations and almost all the social cognition evaluations we do are in person. But those initial meetings with the parents and then the feedback session, it can be done through Zoom.
thank you.
Sure. And I think other providers are also doing it that way for what it's worth. Okay, so here are some common domains that are involved in a comprehensive neuropsychological evaluation. I'm not going to go through everything in at exhaust, but I do think it's important for parents to see just how comprehensive this process is. So we commonly test IQ, attention span. Attention span, we look at short attention or their ability to focus for short durations. Can they get themselves going and focus well for short durations, or is it that they struggle in longer modalities or vice versa? So, some kids with ADHD, for example, may be good at focusing for for short periods, but really struggle in longer modalities, and vice versa. So, attention span is actually complex. There's a lot of components that go into it, and a good neuropsychological evaluation should be able to tease it apart to that level of sophistication. Executive functioning, which we've already talked about, and I'm sure you all know the basics of that, but executive functioning testing, we look at working memory, which I'll talk about what that means. We'll look at planning, organization, task initiation, cognitive flexibility, your ability to shift your focus between tasks. I mean, there's a lot of things we look at with executive functioning. Phonics and rapid naming skills, these are essential reading skills that underlie the foundations of reading. We look at verbal and nonverbal learning and memory, language skills, reading, writing, and mathematical skills, social cognition, personality, emotional well-being, and also adaptive skills, which to me is such a critical part. I look at adaptive skills in every single person I see in my office. Adaptive skills refers to life skills. So this is the demonstration of hygiene management skills like bathing and eating on on your own, ranging from like more of those simple skills or basic skills or whatever you call it to more complex skills like coming home and doing your homework on time and paying your bills as an adult, things like that. And we have really good instruments that can tell us where our child is with these skills. And I think parents don't realize the importance of adaptive skill development, especially for college readiness, which is its own topic, which we won't cover today. But this is a huge part of independence and development, and you can never look at this too early. I think adaptive skills need to be assessed at every single age. Okay, so these are some common domains that we see in evaluations and that we look for. What you're seeing on your screen here, these are the intellectual quotients from the Wechsler test of intelligence, which is the most widely used test for intelligence. And I think it's important to explain what these things mean because they can be a little bit difficult to understand, and also because they are so widely used. I think as a parent, it's just good to know like what these mean. So verbal intellect, which is really verbal comprehension, refers to a child's ability to understand complex ideas, make connections between abstract concepts, learn vocabulary words, absorb vocabulary words, retain them, use them in conversation. So, verbal comprehension is really a good way to assess how deeply a child can think about abstract concepts. Can they make conceptual connections well? Are they a deep thinker? So, this to me is like, this is so important. Visual spatial skills really refers to the ability to understand space. Not outer space, but literal space. How much space you're in. Can you judge distances between things? Can you take an old school map and navigate with it? Can you parallel park your car without a camera? Again, I think I've shared with you all I'm not very good at any of these things, so I know my spatial skills are not great. But students who are really good with spatial reasoning often, do well in careers that are spatially driven, like graphic design or even sports, because sports places a lot of demand on spatial reasoning. Fluid reasoning, this is a skill, or these are skills that are not supposed to be influenced by any kind of education or anything like that. These are innate skills. What they're supposedly innate skills. I mean, that's the theory, and that's what we think, but of course we never know, right? For sure. But we think that fluid reasoning is innate, and it refers to an individual's ability to understand logic, to understand patterns. Fluid reasoning skills underlie logical mathematics. Kids who are really good with fluid reasoning tend to be really good at statistics, for example. So fluid reasoning is really cool in my opinion. And again, it can tell us a lot about how logically minded a child is. Working memory is really an important executive function. It's considered one of the three core executive functions, and it's like our mental sticky note. So it refers to the ability to take in information either visually or verbally and manipulate it in time and use it. So, in real life, this could look like you know, um, you're telling your kid to do 3 steps in a task, and they're having to hold those steps while executing them. So working memory is actually really important, and kids who struggle with working memory may, forget a step or two. In school, they may get lost a little bit and have trouble, executing things, and they may get tripped up. And there's some really good accommodations for that. Lastly, processing speed. I hate processing speed, the terms, because it's not actually processing speed. So processing speed is not how fast your child, it's often, I will say, not how fast your child can think. It's how fast they can generate output. It's how fast they can get what's up here on paper. A child with slow processing speed almost always, in my experience, is not think they're not thinking slowly. They're actually thinking really quickly. It's getting what's up here onto paper that can be slow and laborious. And the reasons for that are, processing speed's often affected in conditions like ADHD. And kids with ADHD, the prefrontal cortex, there's a motor strip that's involved, and they may struggle with handwriting. And that's a common thing I ask about, like, how's your child's handwriting? And we often see dysgraphia, which you may have heard of, which is, a handwriting issue in ADHD. And it's because of graphomotor issues. And with processing speed, again, it's not if there's a slower processing speed, it doesn't necessarily mean your child's thinking slowly. It might mean that they have trouble getting here to paper. Okay, so some common profiles I see in my office regarding, IQ and those quotients is I often will see a child who is really strong verbally, verbal intellect. Their spatial skills are fine, but their processing speed and working memory are low. So what does this mean? Well, it could mean, again, I say this with a caveat that this is just looking at IQ. I almost always have a lot of other test results to interpret, so I'm just looking at the IQ here. And if I just have these scores and this is what I'm seeing, I may say that the child is very smart. They're a very deep thinker. If they're in a class that requires sophisticated thinking and reasoning, like history or government or something like that, they're probably making sense of it. As long as there's no language problem, they're probably making sense of it. They can understand concepts really well and they can reason really well. But it's probably true that they struggle with written assignments. It may take them longer to get their thoughts out on paper. It's also probably true that they get a little lost when the teacher's asking for the student to do multiple things at once, or they're asking the student, they're giving commands and such because the working memory is affected. And this could lead to a student feeling pretty frustrated, understandably. Sometimes we may see a student has really strong spatial skills. Their verbal intellect might be average and fine, but their processing speed and working memory are affected. And in a student like this is important to know as well, because students who have strong spatial skills, they may learn better differently. And the educational systems here are very verbally heavy. And for a student who their verbal skills are okay, but they're not fabulous, and they learn much better, or they're much more spatially inclined, well, I want to know that because I want the school to help them learn in the best way for them. And we may say that as much as you can provide visual aids, provide graphic organizers, try to teach the student verbal concepts and verbal instruction in spatial ways. And that can be achieved actually. And for a student who is strong spatially, again, with average verbal intellect and low processing speed and working memory, we would expect to see the same kinds of things that we would see in the profile I just discussed. They may struggle with getting their thoughts out on paper. They may be thinking quickly, but they may get mixed up. They may get easily confused. Students like this, and also the profile I just discussed, may benefit from what we call a high input, low output environment, which means that they're receiving a lot of stimulation academically, but they're not necessarily having to generate output to show what they truly know. We can test their knowledge in other ways that places less demands on that system, but they're still getting a lot of that instruction because they need that level of stimulation, if that makes sense.
Mhm.
Another common domain that I may see, we may see a student with really strong verbal intellect but low spatial skills. And this, this can be tricky because there are some classes that you can't necessarily avoid that are spatially heavy, like geometry, for example, is often hard for kids who struggle spatially. And but again, we want to know about this because there are certain accommodations we can put in place to help with this. So, for example, a student may struggle again with geometry, and if we know that going into geometry, the instructor can modify the way they teach geometry to that student, or that we might get them a tutor, an outside tutor to help the student learn geometry in more of a verbal way and talking through the concepts and so forth. Okay. So here are some other domains which I had touched on earlier. I want to give a little more attention to these, though. No pun intended. So we'll start with sustained attention. So sustained attention refers to a student's ability to focus for prolonged periods. That's simply it. That's really it. And for students with ADHD, we tend to see variability in this. They may focus for a minute or two and then kind of zone out, and then maybe come back and kind of zone out. Some students may zone out the whole time. Some students may struggle with staying still and they might get restless and they might need to move around a lot. And a good neuropsychological evaluation should tell you all of those things. If your child has trouble focusing for long periods, well, that could make a long lecture really tedious. And what does that mean? Well, maybe, depending on the student, maybe we get them movement breaks where they can get up and walk around. There's different types of interventions we can implement based on what we know about sustained attention. Language is something else we look at, I think, pretty closely, and language can be divided into expressive and receptive. We also have something called higher order language, which refers to the ability to understand figurative language, understanding nuances and sarcasm, and we also look at that too. But for the purposes of this talk, I'm going to give more attention to these things. So, expressive language refers to the ability to express yourself either verbally, orally, or through writing. And we look at a child's ability to find the right words to say in conversation. Do they have that tip of the tongue thing, which we all get on some level, but that tip of the tongue thing, are they getting that more than we would expect? Can they generate cohesive, concise sentences? Are they grammatical? Do they have grammatical issues? The articulation too of their words. Are they having disfluency or articulation issues as they speak? We also look at receptive language, and receptive language refers to the ability to understand what people say to you or understand what you read. And this is really important because receptive language with expressive language, oftentimes parents will say, "Oh, she really struggles with vocabulary," or, "Her vocabulary is not where I would expect it to be for her age," or "She really struggles, sometimes she gets really stuck on a word." You can see it a little bit more clearly, but with receptive language, I mean, it can be hard to detect. And that's why that's why we have testing. But oftentimes with receptive language challenges, we're seeing reading comprehension issues. So it's the same part of the brain. If you have trouble understanding what you hear, you will invariably have trouble understanding what you read. In turn, if we're seeing expressive language issues orally, we almost always see writing problems because it's the same part of the brain. This distinction is really important. And at Stixrud, and really it's in a good evaluation, should look at both of these domains. I prefer to also look at higher order language, but at the very least, we want to see testing of expressive and receptive language. And we also want to see testing of reading and writing, which we'll talk about in a minute.
So Dr. Namazi, I know you wanted me to help you keep an eye on the clock. We have about 4 or 5 more minutes. And we also had a question about who takes the neuropsych report and creates the IEP. Is that the provider, like the Stixrud Group, or someone else?
So it really depends. The school system likes to see the reports come from parents usually, but we are involved as involved as you want us to be. So if you want us to come to meetings, we are there. If you want us to send the report to the school, we're happy to. I was going to get to this, and I'm sorry that I'm running out of time. But the report, and in fact, Debbie, maybe I'll skip ahead because I think this is important. I was going to show you some figures, but maybe you'll just have me come back and we'll do a second. We'll do
Yes,
it too.
you're
Um,
invited back always.
yeah, so I think I want to get to this because this is important. So I do think it's important that parents share the results with the school. However, I want parents to read the report first. So it's important that you read it, that you feel comfortable with what it says, and that there are no mistakes. We're not perfect. I mean, I make mistakes sometimes. I forget to add things, or I might have a typo here and there. And we want to make sure that that document, that product is perfect and it sounds like your kid. That is so huge. And once that feels right to you, then you are encouraged to share the results with the school. You are encouraged to send it to the IEP team if we're thinking we need an IEP. And we are here in any capacity that you want. And I always say we're here as needed. We're here for whatever you need regarding that process. I also think it's important that the results are shared with therapists and other individuals working with your child because they're able to see, they're able to meet your child's needs by learning about them, I think, through the testing. And this is kind of a silly suggestion, but I think it's actually really important. And you wouldn't believe how many times we have parents calling, and we'll always keep your reports. I mean, until we will keep them. But I think for parents, it's important to remember like the report needs to be stored in a safe and accessible place. You will be referring to this report way more often than you think. So you want to be able to pull it up when you can. And finally, the evaluation, we should be able to use the results in a lot of ways. This is not unreasonable to expect that the evaluation should help you set realistic goals, help your child set realistic goals. It should serve as a benchmark, as a baseline. We usually recommend testing every 2 to 3 years. Brains change, kids develop, kids change, and we want to continue monitoring them. And that's what testing can do. Testing is also good for guiding therapies. There's different types of therapies for parenting. There's different types of therapies for reading. There's different types of therapies for all sorts of things. And testing should be able, again, not unreasonable to expect that testing can tell you this type of treatment will probably work for your kid because of this. Of course, we're not fortune tellers, but it can guide what types of therapies might be most useful and helpful for your child. I touched on this earlier, but testing should assist with school placement. And again, depending on the age of the student, this is a whole nother topic that I think we need hours to talk about. But the testing can help determine college readiness. It can help with college process and college placement. A lot of times parents are asking me, is college even feasible? And that's a totally reasonable question to ask.
So, Dr. Namazi, that was incredible. And I just want to make sure in the last minute or so that we can answer a couple quick questions. I'm going to go a little bit backwards, but Felicia had a question. Hi, Felicia. Two questions. One is, how often should your student get tested? I know like in the private schools, they often ask for every 3 years. So that was kind of our rhythm always. But you can answer that in terms of like if it's not required. And as your child ages, do the evaluations test or check for different things? So do they change as your student changes, or is there another way of looking at that?
Yeah, so that's a good question. And I would say that it really depends on the child. I like to see testing done every few years. I like to monitor the kids. But at a certain point, you don't have to do testing anymore. So like in college, after college maybe, but then you shouldn't have to get testing. Again, the prefrontal cortex develops until we're 26, 27, 28 years old. And after that, I mean, as you know, that again, another topic for another day, but we age and things can change. But I think for the purposes of this, I think a good rule of thumb is probably every few years.
Mhm. And does it change then as the kid ages, like what you test specifically?
It depends on the what you're seeing. So sometimes I have parents in my office who are testing elsewhere and now they're starting to see social pragmatic differences. Like, oh, my child was really social and now they're really struggling and I'm wondering about autism. So, I mean, maybe you didn't look at autism before. So now we're looking at autism. I personally think that comprehensive neuropsychs should look at everything all the time. That's the purpose and that's the point of it. But your concerns as parents may change, which may guide what type of testing is done.
We also had a question about, is there a way to test if children comprehend subtle meanings or underlying intentions in receptive language?
Um, Read that again, Debbie.
So what the question was, is there a way to test if children comprehend meanings, or underlying intentions in
Yeah.
receptive language?
That would be higher order language. So yes, the answer
Mhm.
is yes.
And then what's the typical time frame for beginning to end? Um, and then there's one more question. So
Okay. So typically, depending on when you call the office and when you make appointments, again, this is just for me and Stixrud Group, this is not universal. But usually the testing is done over a couple of days and it's usually 2 weeks between parent interview and parent feedback session, which is that last appointment. And then I personally write my reports within a week or two after that. So maybe a month, I think, in getting the written product.
yeah, and it really does vary practice to
Yes.
practice. So
Yes.
that's excellent. So I will put a plug in for that.
Yeah.
And then finally, I did share this in the chat that you did mention before the of summer openings, but there was a question about wait time in your practice, but I'll let you let
Yeah.
everybody know the good news because that's not always the case.
Yeah, so we do have summer openings and we're taking new people and we're here to help you all. So, if you're interested in getting
Mhm.
testing, please call us and we'd love to help.
Yes. We do have one more question and then we'll wrap it up. But if your child, what's the earliest age the test can be taken? I'm going to put these two questions together. And if your child's been tested at a younger age, should we redo the full battery of tests as he completes high school and focus on certain tests?
So we see children as young as 2. Okay, so it can start fairly early. And I would recommend for that particular student, depending on how long it's been. So if a child had testing in the elementary school years, you should get testing before college, actually, because that can really help determine accommodations and the best college placements for that student. College accommodations are different than accommodations that are offered in high school and middle school and so forth. So it is good to have testing before. And again, that's a whole nother topic that I'd love to talk about, and the differences with college readiness kinds of testing versus other types of
Well,
tests.
we have 9 months starting in September to get started all this over again. So we need to chat over the summer.
Sure.
And I will just end by saying, well, in addition to thank you, which I'll mention that everybody's pouring in saying how informative it was, which of
Oh,
course
good.
it is.
Good.
And I will also mention that, having my son tested right before college was just really, really helpful. And so I would mention that also for that last question. But Dr. Namazi, your organization, Sixth Root, is such just a treasure trove of knowledge, and we really appreciate you sharing all of this. It's so confusing for those of us who are not in this every single day. And thank you for all this information and for helping to clear it up for those of people who are, don't always have access to this type of information. So we hope everybody has a wonderful summer. We hope to see you over the summer here at the StudyPro, and of course at Stixrud if necessary. And we can't wait to have you back next year, Dr. Namazi.
That was fun. I hope this was helpful. Thank you so much for having me, everybody.